How did doctors resist early hygiene practices? Imagine a time when the idea that washing hands could save lives was met with disbelief and even hostility. That was the reality in the mid-1800s when doctors refused to accept basic hygiene measures. Back then, the main medical theory explained disease as an imbalance of the bodies for humor, not as something caused by tiny invisible germs. Because of this, many believed that cleanliness had little to do with preventing illness. Doctors thought each disease was unique, so they doubted that a simple act like hand washing could stop different illnesses. When doctors performed autopsies, they saw varied symptoms in diseases like puerperal fever, which made them think it was many different diseases, not one contagious illness. This made it hard to accept the idea that germs could be transmitted from one person to another. Ignaz Semmelweis, a Hungarian doctor, was one of the first to show that doctors spreading infections from dead bodies to mothers caused high death rates. He started requiring hand washing with a chlorinated lime solution in 1847 at Vienna General Hospital. His efforts cut death rates dramatically. But many doctors rejected his ideas. They saw his suggestions as an insult to their professionalism and social status. Some doubted that invisible particles could cause disease or questioned his methods. At that time, the germ theory of disease had not yet been developed, so there was no scientific explanation for Semmelweis's findings. Without this theory, many viewed his antiseptic practices as old-fashioned or unscientific. Critics argued that the reduction in deaths could be due to chance or other factors. Some demanded simpler experiments, like comparing doctors who handled cadavers to those who did not. The hierarchical nature of the medical profession also made it hard for new ideas to gain acceptance. Many doctors felt their authority was challenged when evidence suggested they might be unclean or responsible for spreading disease. In the end, it was only after Louis Pasteur and others proved the germ theory that doctors fully embraced hygiene practices. Once they understood that tiny germs caused illness, hand washing and antiseptic procedures became standard, saving countless lives.